right, hello everyone, and welcome to the GI module pharmacology drawings. A couple things before we get started. First of all, I, due to time constraint, did not color all of these photos, pictures, whatever you want to call them. And the ones that are colored aren't super detailed, but I know that helps with memory, so I apologize, but it is what it is. And then second of all, I may be 24 years old, but I still find poop and farts and butts hilarious. So y'all are in for a great video. It's going to be pretty goofy. And so with that, I'm going to start off with a joke. And that is, what do flies politely say to one another? And they say, excuse me, is this stool taken? All right. So with that, we're going to get started on our first scene, which takes place in a bathroom. And these are going to be drugs for GERD. So we have a bathroom, and there is an alligator. And alligators, they growl at people. They go, GERD. And so that helps you remember that these are for GERD. And these are all antacids. So all the drugs I'm about to mention, they bind to hydrochloric acid in the stomach. And that's, I don't know why I wrote ant. That's supposed to say and neutralize it. So bind to acid in the stomach and neutralize it. So we'll start off with the alligator here. The alligator is representing aluminum hydroxide, which the brand name is Amphogel, and alligators are also amphibians, amphibian Amphogel. Riding on top of this alligator is our Alka-Seltzer dude, whatever his name was, like Fizzy or something, I don't know. And so he has a large ass for aspirin, and he's holding an orange, a citric acid, and sodium bicarbonate. You just have to remember. But anyway, that's because Alka-Seltzer contains both aspirin, citric acid, and sodium bicarbonate. And so the alligator here, aluminum has a lot of side effects. It gets into your red blood cells, your central nervous system, your bone, and it causes constipation. So this alligator attacked this dude that's sitting on the toilet. He ripped his bone out. You can see it there. Bone for, causing bone problem. The dude's on the toilet, so constipation. And then there's probably should be blood on the floor representing red blood cells. So that's the adverse effects of aluminum hydroxide. And then let's just move on to the dude on the toilet, right? So he's on the toilet, he's reading a magazine. So magazine for magnesium hydroxide. And it's hard to tell, but he's holding his tummy here. His Tums, which is calcium carbonate. And magnesium causes diarrhea. So this guy, he's just constipated and has diarrhea. He's just not having a good day. Within this bathroom, we have a window to the outside. And so we have a mailbox, which is representing Maalox. That's the brand name, which is a combination of aluminum hydroxide and magnesium hydroxide. And then we have this car, sodium bicarbonate. So sodium, there's all these Na. So sodium bicarbonate, and it's represented by the Batmobile because it goes na 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 Batman, just like that. And then an extra one that was in the lecture that wasn't really, it was just mentioned in class, is simethicone. So there's this bathtub here, has a bunch of bubbles in it. These ones are in the shape of a cone, simethicone, and it just turns big bubbles into smaller ones, which they're all the same, but anyway, that's okay. And all of these antacids should probably be used, well, I should say, simethicone's not an antacid, but whatever. All these should be used short term. So still drugs for GERD, but now we're going to talk about the histamine antagonists. So H2RAs. So these are all going to block histamine at the H2 receptor in the stomach. So here we have a family of snakes. The snakes go hiss for histamine, and they're mean snakes. Histamine. Not only are they mean, but they're also Nazis. So we have a family of snakes. Fam, and they're dining. So famotidine or famotidine. And like I said, they are mean snakes because they're Nazis for mesotidine. Mm-hmm. And for whatever reason, this cement truck decided to kind of rain on their parade, rain on their dinner, and dump cement for cimetidine, which, just pro tip, is also an H1 blocker. There are not really any adverse effects for this drug class other than some minor drug-drug interactions. And remember, it's in the stomach, like it blocks histamine in the stomach, so that's why there's a stomach on the table. All right, so next we have our proton pump inhibitors, which again are still for GERD. And so this one is really goofy, but we have this French lady here, and I'm not very good at imitating a French accent, but she's like, oh my, I see a dad wearing pumps. They is so nice. So she says, oh my, for omeprazole. And then she says, they is so nice. As nice as omeprazole. The C dad I will get to in this moment. But so yeah, we have this dad here. He's walking with his child and he's wearing pumps. And he's also wearing pants for pantoprazole. And his child here is foaming at the mouth because he has rabies, rabiprazole. And just think about how kids are very dexterous, whatever. Anyway, dexlansoprazole. And while the dad is wearing pumps, the kid is wearing those Vans shoes, Vans for lansoprazole. So that's all the drugs in that category. All of these are going to block the final step of acid secretion in active pumps only. So the final steps, we have some steps here of acid secretion. So this is an acid bottle with acid in it. And then its adverse effects are hypocalcemia, showed by the spilled milk here, hypomagnesium, magnesemia, which is shown with the magnet, and then CDAD, which is Clostridium difficile something disease or whatever it stands for. So she's like, I see a dad. So CDAD. And then we have refractory disease, so a prism, because light refracts and turns into a rainbow. And then B12 deficiency, which I showed with the little price tag that showed that the shoes were only 12 bucks. What a deal. And so now we're going to change to drugs that are for peptic ulcer disease. So peptic, that's why we have Pepsi in here. They're advertising. So our first drug for peptic ulcer disease is called a potassium competitive acid blocker. So we have acid and we have potassium. They're competing against each other, playing volleyball. Volleyball helps you remember the drug name of vonoprazan, which is, they both start with VO. And so the mechanism of action is that it inhibits your hydrogen, potassium, ATP ACE pump, and it blocks the resting and active pumps. So again, we have our hydrogen and our potassium and our ATP. And the adverse effects of this drug are nasopharyngitis. So he's got a runny nose. There's some snot coming out of there. And then musculoskeletal bone pain. This guy, he's banana. He's been working out. He's muscular. Even though he doesn't look like he's been in pain. And so, and oh, I should have mentioned this before, but you would use these drugs listed plus all the other things that were covered up above. But moving on, we have this lady here, and she is eating miso soup for misoprostol, and it is a prostaglandin analog. And I always like to show prostaglandin by like someone kneeling down, just if it helps. Think of prostitutes have to kneel down, get on their knees to do their dirty work. And adverse effects are diarrhea, shown here. And she is not pregnant. Okay, it looks like she is. She's got a little bump there, but she's not, because this is contraindicated in pregnancy due to the fact that it can dilate the cervix. The other drug in this category for peptic ulcer disease is sucralfate, which binds to the ulcer crater in your stomach and protects from hydrochloric acid and digestive enzymes. So, in case you didn't know, the French term for sugar is actually sucre. And so I have these little sugar cubes, and they are binding to this big crater, this ulcer in the ground. And then the adverse effect is constipation. And I drew a little star here because I think constipation sounds like constellation. And so the star will help you associate that. Don't worry, there's more about that to come. So I believe that is everything for that one. So next we move on to a lot of drugs that we've already covered. So you can see they're not really colored. But these are all going to be drugs for inflammatory bowel disease, which is Crohn's and ulcerative colitis. So pretty much all of these are just remember they're anti-inflammatory meds. Anything that has a star next to it, like a little tiny star next to the MOA, is something that he actually mentioned in class. But some of these other ones, like sulfasalazine, in this PowerPoint, he did not mention the MOA and the adverse effects. He just said, oh, they're anti-inflammatory. I wrote them down just as a good review. So we'll just go through them. So we have 5 salamanders on a sofa for sulfasalazine. There's 5 of them because this is a prodrug of the 5-amino salicylic acid, and it is an anti-inflammatory drug. So we have the anti-inflammatory right here in the middle. And then the adverse effects were rash and headache and bone marrow suppression and GI. And then these 3 drugs, these are new. So we have a messy llama eating an old salad with balsamic vinegar on it. So messy llama is for mesalamine, and he's eating an old expired salad. Old salad for olasalazine, and then he has balsamic vinegar for valsalazide. These inhibit prostaglandin and leukotriene synthesis. The llama is white leukotriene. That's all I got. Adverse effects are GI, which sucks because you're taking them for GI, but whatever. You can use steroids for your inflammatory bowel diseases, such as budesonide or prednisone. So Buddha on a slide, budesonide. We can use azathioprine. So this is a guy playing jazz, and he's got his thigh out because he's into it. So as for azathioprine. And it inhibits DNA and RNA synthesis. So we have this little DNA strand here. Adverse effects are bone marrow toxicity and hepatotoxicity and cancer. Next, you could use cyclosporine, which is a calcineurin inhibitor. That's what the CAN stands for. Adverse effects are hypertension, tremor, and nephrotoxicity. To remember tremor, I always think if you've ever seen someone ride a unicycle and they're like trying to balance on it, they're like kind of tremoring. And now here we have a picture of Adam, who is a certified Netflix watcher. So these are all monoclonal antibodies against tumor necrosis factor alpha. So Adam for adalimumab is a certified certolizumab Netflix watcher infliximab. Adverse effects are infusion reactions, unusual infections, and lymphoma. Then we have our methotrexate, or as I like to say, methotrexate, which inhibits dihydrofolic acid reductase and decreases DNA synthesis. So in this picture, we have these little baby horses, these foals, and they were like, in my other picture, they were colored blue because they're like hydro foals. And the T-Rex ate them. He ate one of them. And so there's blood coming out of his mouth for anemia. And there's the little poor little foal's liver on the ground for hepatotoxicity. And then this is a new one. There was no other, there's no adverse effects or anything other than the fact that it's just an anti-inflammatory drug, immunosuppressive drug, and it's mircaptoprine. So we have a meerkat. We're in a cap. Mircaptoprine. Then we have some more monoclonal antibodies. So we have natalizumab. So this is like a neonatal natalizumab, which is a monoclonal antibody against leukocytes, preventing CNS penetration. This is one of those drugs that's highly regulated, and you have to be part of a touch program. So like these hands are touching this neonate. Adverse effects are infusion reactions, progressive multifocal leukoencephalopathy. So the head is a little misshapen here. Acute retinal necrosis. That's why it looks like a little demon baby with the red eye. Retinal necrosis. And then hepatotoxicity. Look at the little baby liver. There it is. All right. Next is our vedolizumab. So this reminded me of those super annoying like European emergency vehicles that are like Vedo, Vedo, Vedo. Like what kind of siren is that? I don't know. So I drew that. And this is a monoclonal antibody against T lymphocytes, inhibiting penetration into GI tissue. So T lymphocytes, here's a big colon for GI tissue. Adverse effects are infusion reactions and infectious disease. And again, all of these are just drugs for inflammatory bowel disease. All right, and then we move on to this first picture here it's not good, I'll be honest. So bear with me. We have this Vietnamese lady, okay? She wants to go to a buffet. She wants to get there as soon as possible, and she's like in a race to get there. So she hops in her little space shuttle here. Space shuttle takes off. And it's like, wow, look how high it is in the sky. It's gone so far. And it's in the lead. So it's in the lead. It's leading. It's led a pass sphere. And it's gone so far into the sky for so far Buzuvir. And those are both like, that's a generic, and it's like the brand name is Harvoni. And that reminded me of Havarti, which is a type of cheese. So, got a big hunk of cheese here. So the ledapasphere is a protease inhibitor, and then the sofavir is a NS5B RNA polymerase inhibitor. I'm not sure how to remember those, but I just wrote it on the rocket ship. Adverse effects are headache, so there's little headache lines because, I don't know, the rocket ship has a headache. And then weakness and fatigue. So anyway, this Vietnamese lady, she makes it to the buffet. She first eats some Havarti cheese or Harvoni. And then she has some ribs for ribavirin, which inhibits viral protein synthesis. So there's a virus on there, and ribs are protein, viral protein synthesis. And unfortunately, because there was a virus on the ribs, she got food poisoning. Okay, and so just kind of think about that. It might help you remember that, like, She's gonna have nausea, and she's gonna feel really fatigued, and she's gonna have muscle pain like myalgia, maybe like a fever. She's not gonna want to eat any more food, so she's gonna have anorexia. And then some of the other ones, like alopecia and hemolysis, stuff like that. Now, the reason why she's Vietnamese is just to help you remember that there's this other drug called a Viet Cara pack. So Vietnam, like yep. So she got in her rocket ship and she orbited around the Earth. And then when she got to the buffet, she had a margarita and then she had some Ritz crackers. And like, that's a lot of food. That's a beer. So orbit for Ambitavir. She had a margarita for Parvita Pravir. She had some Ritz crackers for Rita Navir. And then, like I said, that's a lot of food. That's a Bivir. Again, she is fatigued and has nausea, and she's kind of itchy. I think that's what those lines are for. She looks like she hasn't slept in a long time. She has insomnia. She's got big lips for angioedema and then liver dysfunction. So this chick just should have skipped the buffet. Next, we are going to talk about drugs for nausea and vomiting. So these are ones we've already covered. And so I just kind of quickly redrew them. Actually, this one's new, but anyway. So these are drugs that antagonize dopamine in the chemoreceptor trigger zone, which is abbreviated CTZ, in the brain. So these are going to bind and block to your dopamine receptors in your brain. So we have compazine, so computer for compazine. We have our 40 whatever president, Ronald Reagan, smoking a doobie for Regland. And Ronald Reagan wanted to go to Rome, so promethazine. And like I said, they're just all drugs for nausea, vomiting, and they cause movement disorder and sedation. And I'm actually going to skip these just for a second and go, because these other nausea, vomiting drugs kind of go along with the dopamine. Like these two are also dopamine antagonists. So we have one of those like psycho like voodoo dolls here, and he's ziplining and he has a halo. So halo or haloperidol, and this is a first generation antipsychotic, which is why I drew a voodoo doll. Antipsychotic dopamine antagonist. So again, it's going to block dopamine receptors. And then it's ziplining over land for olanzapine. And this is a second generation antipsychotic dopamine antagonist. It's ziplining over seeds, over land, over some pine seeds, whatever helps you remember that, over land, pine seeds, because they both cause sedation and movement disorder and orthostatic hypotension, which is pretty similar to these other ones. So then let's go back to this one. So these are our serotonin antagonists. And so we have Granny here, and she is dancing to the piano music that's playing. So Granny for Granicitron, and she's dancing for Odancitron. And there's music being played by a piano citron, and then she is gonna do limbo for do dola citron, but anyway. And the height of this limbo stick is 5'3", because the mechanism of action is that this is a 5-HT3 antagonist, that just means it's a serotonin antagonist. Adverse effects are headache, because she's like, it's too loud. The music is too loud. It hurts my ears. I have a headache. And then arrhythmia. She can't dance. Are you kidding me? That's shown here. She doesn't have rhythm. She's grandma. And then we have some more that we already covered. And then I redrew these very quickly and they're not represented very well. But we have diamond hydronate, which is known as Dramamine. And then we have Benadryl and Antivert or Meclizine. These are all anticholinergics, antihistamines, and they cause dry mouth and sedation. I'm just gonna kind of skip through those. We're almost to some of the good stuff. Okay, still talking about nausea and vomiting. Here we have a scene with the Sesame Street characters, and they have turned into cannibals. So they are marinating this dude on a stick. So we have, like I said, Sesame Street characters for Sesamet, also known, well, brand name, sorry, generic name of Nabalone. They gotta nab them up. They nabbed them up. And then they're gonna marinate them for Marinol. Generic name is Dronabinol. So, why are they cannibals? Because the mechanism of action is that these are cannabinoids. And if you think about cannibals, it might help with some of the adverse effects. Well, let's just start with dizziness and vertigo. This dude is probably dizzy and has vertigo. He's hanging upside down and he's being carried backwards, basically. These Sesame Street characters seem a little euphoric and a little manic because look how happy they are to be cannibals. Probably some paranoia going on. Somnolence, which is like again just like fatigue and whatever. It's not super helpful. Depression. This guy, he's bound to die. He could be depressed, and then he's also ataxic. He can't move. He's tied up. He can't move. He has ataxia. So that's that one. And then just some other drugs I didn't feel like drawing out again is lorazepam, which was our Lorax who was vacuuming up the garbage because lorazepam is a GABA something antagonist or something like that. And then we have dexamethasone and methylprednisolone. All right, here we go. Drugs for diarrhea. This takes place in the old Western desert. And at the center of a town, we have two people in a standoff. And one of them says to the other, "This town ain't big enough for both of us. Someone's going to have to die in this area." Diarrhea. So, anyways, over here we have a dolphin ox with a pine tree as their fin. That is representing atropine plus diphenoxylate, because Dyphon sounds like dolphin, ox, yeah. And it's a dolphin out of water, and he has like I said, his fin is a pine tree, so he's not going anywhere. He's got low motility, low modal. Mechanism of action is that this dries up secretions. They're in the desert, slows motility. Like I said, he can't move, his fin is stupid. And then just the reason why there's atropine with this is because it lowers the abuse potential. But adverse effects is that there is abuse potential. And then it could cause constipation because all drugs that are for diarrhea could go the other way and cause constipation. And then dry mouth because it's drying secretions. And next we have this dude here, and he's like, "Yeehaw! I'm a catch me a dolphin ox." So he's got his lasso out, and he's like, "Rope her, she's mine." For lopermaride, loper. And he's slowing the motility because, once you lasso something, you slow it down. So it slows motility. And then adverse effects are abuse potential and constipation. So now we're going to move on to this blacksmith here. Blacksmith for bismuth subsalicylate. And he's pounding away, tinking away on this little microbe here because it's antimicrobial. And if you think about what blacksmiths have to do, they have to heat up the metal first and then pound on it. So, but this guy, he's not a very good blacksmith because he doesn't have flames. It's anti-inflammatory. And then it has an anti-secretory effect. Again, we are in the desert. Everything's all dried up. Adverse effects are black tongue. He's a blacksmith, black tongue, and then nausea. Also, so he's pounding on stuff. It's going ding, ding, ding. And then he drops his horseshoe. He's like, oh, I dropped it. Oh, for opium tincture. And this is an opioid agonist in the GI tract, which again slows motility and secretions. Adverse effects are, again, constipation, which is why he has a star here, nausea, vomiting, pruritus, and respiratory depression. Most of these are not shown, but that's okay. And then over here, we're like, there's a train on the loose, a loose train, or a loostron. And it's a very tiny train. Its height is only 5'3" because it's also a 5-HT3 receptor antagonist or serotonin receptor antagonist. So it blocks serotonin receptors. Adverse effects are constipation, GI pain, and then nausea. And then we have these little opium plants here, and they're right next to the train. So as the train drives by, they're going to vibrate back and forth. They're vibrating for Viberzi, also known as eloxadoline. And so this is an opioid agonist, which is why they are opium plants at GI receptors. Adverse effects are the same thing up here as up here. So constipation, GI pain, and nausea. And both of these drugs can be used for irritable bowel syndrome that is diarrhea predominant. And then over here, suddenly we've time lapsed. We've gone from the Old West to now like the hippie era. And we have this, we're going to call this a bus, a hippie bus, for lactobacillus. And it's got flowers on it because this restores the component of GI flora. And you want to be careful using this with immunocompromised patients. And like, look at the color of this. Like, wow, whoever decorated this really lacked taste in their design. So lactase, and that is an enzyme that digests lactose. Adverse effects are none, really. That's not applicable. Now, this bus here needs some gas. And I'm sure we've all heard of like high octane gas, so octreotide. This is going to decrease growth hormone and gastrin. It's a gas can for gastrin secretion. And those are both pro-motility agents. So if we reduce growth hormone and gastrin, we're going to slow down the system. Adverse effects are headache, gas. If you sniff and gas, you're going to get a headache. You might feel nauseous. Other effects are arthralgia, diarrhea, and bradycardia. Bradycardia. All right, we're almost done. Bear with me. It is now time for the constipation constellations, which is spelled wrong, but that's okay. So all of the drugs for constipation have to do with like space and constellations and stars and stuff like that. So what better to start with than the constellation that everyone knows, the Big Dipper? Well, what are dippers used for? They're used to draw up water so you can drink out of them. So all of these within the Big Dipper are going to have the mechanism of action of drawing water into your stool. So we have a mirror for Miralax, which is also polyethylene glycol. We have a magazine with some citrus on it for magnesium citrate. And then some people are like, oh yeah, the fate is in the stars for sodium phosphate. And then look at this star, it's just glycerin, a glistening glycerin star. And then we have lactulose, or, it ends in the word lose. Yep. And, you lose teeth, loose tooth. So those are all drugs that draw water into your stool, and the adverse effects is, the opposite of that, which is diarrhea. So now we're going to talk about some bulk laxatives, which cause stress stretching in GI muscle, which stimulate peristalsis. So we have this comet that is stretching across the sky. Look at it. Stretches all the way across the sky, stretching for stretching GI muscle. And it is fibercon metamucil. Comet, comet, fibercon metamucil. And the adverse effects are constipation. So this is a good time to insert another little joke I have, which is, if you're constipated, you gotta be really careful. You don't want to get those hemorrhoids or asteroids. All right, moving on. We have our stimulant irritants. So these are drugs that are going to irritate GI muscle, which would then, again, kind of stimulate your GI to move it through. And so here we have an Italian astronaut, and he's like, it's a bit cold out. Hey, look, the sun. So it's a bit cold is bisacoral. And then he's like, look, it's the sun. Sun. And then these cause diarrhea, like everything else. Then we have docusate, which we learned in our heat module. And in that module, it draws water into the ear canal. In the GI system, it's just going to form a soapy film around stool. So we have an astronaut, and he is sitting on the dock, and he has a big soap bubble around his head. And again, diarrhea. All right, time for another joke. So these are we're going to talk about some lubricants. And we have an astronomer, and he is casting a net around the planet Uranus because he wants to examine the minerals that are on the planet Uranus. And so the mechanism of action is that it traps water into stool. So he casted the net so that it could trap it. Anyway, so castor oil and mineral oil are both lubricants, and they can cause diarrhea, oily stools, obviously they're oil, and then reduce absorption of fat-soluble vitamins. Then we have linaclotide, or stars that are in a line linaclotide. And so we have the Gemini constellation. Again, I don't know how to spell the word constellation apparently, but we have stars, boom, 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 they're in a line. And this is Gemini constellation, GC, for guanylate cyclase C, or GCC. Agonist on intestinal epithelial cells, which leads to fluid secretion and transit. It's going to move things through the system. Then we have a stone that is in the shape of a heart, and your heart goes lub-dub. So lubiprostone. It's got Cl on it because it's a locally acting chloride channel activator that increases intestinal secretion and motility. Pretty much the same thing as all the other stuff. All right, and then this one, it's not very good, but we have this cute little T-Rex here, and he's like, I want to learn about the stars, so I'm going to use this telescope here. He's like, hi, my name is Nail. And Nail thinks that he's a cat, and so he goes, meow, meow. So this is methyl, is representing methyl naltrexone, or T-Rex. This is a oral and sub-Q locally acting mu receptor antagonist. That's why he thinks he's a cat and says meow. And then his name is Now, or naloxegol, which is an oral locally acting mu receptor antagonist. Again, adverse effects of diarrhea. And then we have I just want to mention some stuff that I did not draw pictures for. So there are a couple more drugs for irritable bowel syndrome that are diarrhea predominant, and that would be your I don't even know how to say this, Lebsin, and then dicyclamine or Bentyl. You want to take a look at the H. pylori regimens, which are antibiotics. There's also some antibiotics for C. diff. So the classic one that you want to use is fidaxomicin, but it's very, very expensive. And so you'll probably end up using vancomycin, metronidazole. You can also do a fecal transplant. And then there is a monoclonal antibody against C. diff called bezlotaxumab. Um, so those are there. And then there was a couple slides on drug-induced liver injury, which is mainly caused by acetaminophen, overdose on acetaminophen. And so acetylcysteine is one of your antidotes. I spelled that wrong. Maybe not. I don't know. Anyway, some other causes of liver injury other than acetaminophen would be a bunch of other drugs that we've already talked about. And then I just realized I don't have this finished. I didn't write it down, but there are 3 slides about drugs that treat cirrhosis, not psoriasis. Jeepers. Okay, I'm just going to read them off to you so that you have them. So you have antibiotics such as ceftriaxone, ciprofloxacin, Bactrim, the fidaxomicin again, the metronidazole, neomycin, norofloxacin, I don't know how to say this. Anyway, then you can use some beta blockers such as nadolol and propanolol. You could also use some somatostatin analogs such as octreotide, which we did cover already. And then you can use antidiuretic hormone such as vasopressin, and then you can use diuretics such as furosemide and spironolactone. Okay, so that is everything. I hope that you enjoyed my really corny jokes, and I'll see you next time.